Namaskar viewers, hello and welcome to Sunset TV. I am Tina Jha. You're watching Perspective. On the show today, we will talk about the State of Inequality in India report, which was released on Wednesday, 18th of May by Dr. Bibek Debroy, Chairman, Economic Advisory Council to the Prime Minister. Written by the Institute for Competitiveness, the report presents an analysis of the depth and nature of inequality in the country. It compiles information on inequities across sectors of health, education, household characteristics and the labour market. While releasing the report, Dr. Bibek Debroy said, inequality is an emotive issue. It is also an empirical issue since definition and measurement are both contingent on the metric used and data available, including its timeline. He added that to reduce poverty and enhance employment in the country since May 2014, the Union government has introduced a variety of measures interpreting inclusion as the provision of basic necessities, measures that have enabled India to withstand the shock of the COVID-19 pandemic better. However, there are some indicators on which a lot of progress is to be made to reduce the prevailing inequities. To discuss some of the vital findings of the report and how will they help in formulating reform strategies going forth is something that we will discuss on the program today. And for this, joining me is a distinguished panel of experts. Let me first introduce them to you. With me in the studio is Mr. Shubhamoy Bhattacharjee, Consulting Editor, The Business Standard. Thank you, Mr. Bhattacharjee, for your time. And joining us virtually is Professor Amit Kapoor, Honorary Chairman, Institute for Competitiveness, which has, of course, prepared the report, and Professor Charan Singh, CEO, EGROW Foundation. He was a panelist at the launch of the report. Thank you, gentlemen, for joining us on Sunset TV. Professor Kapoor, it's only fair that I begin the program today with you since you're the author of this very, very elaborate report. So first, give us and our viewers a brief overview into the key highlights of your report.
This is, if you really look at what we are trying to do here is we are trying to, one, understand as to what inequity actually means. We are fundamentally not looking at the report to just say that there is income inequality. We are trying to say that there is a multi-dimensional construct or a concept that we need to look at. And that would mean that you have to understand income profiles, you have to understand labor market dynamics, what's the employment rate, what's the unemployment rate, how is it happening within the rural areas to the urban areas. We have to understand health infrastructure, education, and how the availability of education is happening, whether we have the right set of facilities or not, and of course, household characteristics and how, say, people are getting empowered over a period of time. So we have moved beyond a very simplistic idea of saying that it is just about poverty that we have to look at, or it is just about the income levels that we have to look at to understand inequality. We are looking at a much broader view in terms of saying as to what defines inequity. Mm-hmm. And when you really look at this report, there are fundamentally 2 or 3 very big points that actually come out. One is that India, like a lot of people who are saying that there is a lot of inequality in India, it's not true for that matter. If you really look at 1 or 2 things, like one, if I really look at something like, say, school education and the facilities that are being provided at the school level today, they have fundamentally really enhanced over the last 5 years. If you really look at a very simplistic view of availability of toilets in schools, it has really increased over the last 5 years. So what we are really seeing is that as measures of quality of life, they have improved over a period of time, and we've seen that happen in the last 5 years. If you really look at the availability of toilets at household level, that has certainly be a very big game changer in the country. If you really look at the healthcare facilities, what we have seen is that healthcare facilities have really improved in the last 5 years. We have seen addition of public healthcare centers and so on and so forth. So what we are really seeing is that from an overall perspective, there is a huge improvement. But yes, of course, if you really look at the income levels, we see that there is a consistent track record. If you really look at, if I look at the PLFS data, what we find is that, yes, there are a certain level of income inequality that actually exists. The top 10% of the country, or top 10% of the income earning people of the country earn equal to the bottom 64%. That is there, but it is not something which is startling. It happens in every growing economy of the world. But what we have seen is that there is an effect wherein these inequities are actually reducing over a period of time.
Absolutely.
So broadly, the inequities have reduced. And then, of course, if you really look at the income levels, what I do see is that over the last 3 years for which the PLFS data was looked at, we are seeing a consistent trend there. As we are seeing, India is improving. Of course, there are some things that we have to look at in terms of how do we improve the state of being, what are the various things that can be done to move into a better direction. But if you really look at the trajectory point of view, I think the country is in a fairly positive trajectory, and we have seen a fair, good, positive movement.
Okay,
Over
Professor
to you.
Singh. So, a series of efforts which have been undertaken over the past few years have led to this improvement that Professor Kapoor has spoken about in a variety of sectors, which he has categorized in his report as economic facets and socio-economic manifestations. So, if I could, ask you to elaborate on the economic aspect, what are some of the striking features in this report that you particularly find?
And the couple of things that I found that very interesting in this report. Firstly, the concept of it. I must mention that measuring income inequality or measuring inequality in any society is not very easy task. So it has to be multidimensional. And as you see in this report, they have spoken about education, they have spoken about health, and they've also spoken about income. Now, in each of these, they have gone pretty granular and they have taken different aspects of it. I think one thing which stands, and I think that is very important, is when they mention income is far better indicator while computing than wealth. I think that's an important mark that has been made in the report and that should be taken into account. When it comes to education, again, one thing which stands out in that chapter, and it's beautiful, is that when the government is talking about digitalization, and that will reduce or minimize the dependence on brick and mortar schools and the blackboards and teachers. Then when they talk of digitalization and internet or tele-education, that is very important. So they have looked at what is happening on the internet education system, and some states, some schools have that facility and others, there is a problem there. When it comes to health, a very good comparison has been made between the private hospitals and the government hospitals. They've given comparison of how much it costs if there is to be treatment on cancer or childbirth, and then they've said that is coming down. But still, the out-of-pocket expenditure, which has come down significantly, has yet not come to the yardstick or the best yardstick which the government wants, around 7.8. There has been an improvement in public health centers in different states. Now, when it comes to employment, I think that is something very good that the report has marked. The issue is with higher education, expectations go up, and therefore unemployment at the higher end is little higher. And that needs to be addressed. They've marked it. The issue on female labor force participation is extremely important, and that is pretty low in our country, and something has to be done to improve the female labor force participation. And I think the experience during COVID, work from home, digitalization, internet facilities should improve the number of women working from home.
Certainly.
One very important point which has been mentioned, and I think that needs attention, is the anemic population. And of course, they have very clearly mentioned it, that anemic population, and if it's not properly handled, can lead to cognitive problems and reduction in GDP. So in a way, the report has taken a multidimensional aspects of inequality, and at different places mentioned the things that need to be looked at, focused, some good and some that need to be addressed.
Absolutely. So, multidimensional report, but there are certain areas of concern, Mr. Bhattacharjee. Especially what has been grabbing a lot of headlines from the report is a monthly salary of 25,000 means amongst the top 10% of the total incomes earned. Now, doesn't that point towards deep levels of income disparity? And going forth, how can that be addressed? Has the pandemic also contributed to that disparity, according to you?
Well, yeah, you know what I mean. What I like about the report is that it actually looks at inequality exactly as it should be in terms of looking, as Professor Charan Singh said, multidimensional thing, and that's necessary because otherwise you can't just sort of put it into white and black. It becomes a problem. So that's a great thing about the report, that it looks at all aspects of it. Now, talking about the income thing that you're talking about, which is being flagged, the point is a government, whether center or the state, can essentially provide assets to the population, sanitation, facilities of telecom, electricity, gas. Now, these are assets that are coming along, and those, as the report also points out, is rising. What a government cannot, by its very nature, provide is the employment, unless you're saying that everybody will be provided in employment in government work, now, which is obviously not something that we're looking at. So there the problem comes along is a more difficult job of trying to pull in private investment into employment generation facilities. And that is something on which we are getting unstuck for quite some time. And there's no point pointing an easy finger saying that this should have worked or that should work. Because as our challenges in manufacturing also shows, these are not easy things to settle. A large number of our employees, a large number of people are basically employed in the services sector, where for historical reasons we gravitated because the manufacturing sector didn't grow. So essentially, the employment creation part of it is a much more difficult part, and that is something which the report rightly points out is something that will need that is where only up till where the report can go. It is now from there for the government to take on that. Okay, where do we go in terms of trying to create employment? A report on inequality can't really say anything more than this.
Absolutely. And
that is where it stops. To your question on whether pandemic has accelerated or exacerbated the inequalities, well, that I don't think is, the issue. The point is already that there's inequality. The inequality is there, inequality has been flagged. Obviously there are issues about, as I say, the asset level inequality has been coming down, the income level inequality is not really coming down, but that is something where government policies, both at the central level as well as at the state levels, will have to be worked out to create possibilities of employment. Now, one of those is, as we are looking at, is for instance, export-led growth. That creates employment, construction sector. But that's not something which obviously a report on inequality can be flagging. That is something, again, as I said, has to be the next step of working out. Yeah.
Certainly. But Mr. Kapoor, while I was going through the reports about the State of Inequality report that has been authored by you, it also mentioned about certain recommendations on the areas of concern that you have also jotted down in your report. What are these recommendations, particularly if we talk about in a time of rising inflation and rising unemployment ratio in the country, which are two big areas of concern? What are the recommendations that you would expect the government to take on, especially when it comes to these two aspects?
So if you really look at it, like we have given some broad-based recommendations. And again, please, this is not the voice of the government. This is what I personally, as an author of the report, think about. One is, of course, can we create a system wherein we are able to create a scheme like, say, Manrega? Can we create something like a urban employment guarantee scheme? Can that actually mean that, yes, there are going to be people who are actually employed or who actually get some guaranteed employment, something very similar to Manrega. And that can actually reduce the pressures that actually exist. There is also a very interesting figure within the report in terms of what we are really seeing there is what is the kind of employment and what is the kind of work that people do. If you really look at the villages versus the cities, what we find is that the informal work within the cities is much higher. The salaried people informal workers in villages are much higher. And if you really look at the salaried class, it's close to about 20% in the villages and close to about 50% in the cities. So that means we have to create something which is far deeper within the cities because we cannot hide that problem. That is one. The second thing is that we should also see, if you really specifically talk about the pandemic, there is no data today to really say as to what the pandemic has done to inequality or whatever, because PLFS was actually until the March of 2020. But I would suspect that the inequality has not increased or income inequality has not increased, but I'm just suspecting that. But then, of course, there is a certain learning loss that has happened because this 2 years, the schools were not happening. So we need to really move into that direction wherein we are able to recover from that learning loss. The theoretical perspective there is that it can take anything between 3 to 4 years for that learning loss to be recovered. So we need to actually improve or work towards that very specifically because it can have long-term implications and things. And then last but not the least, one of the biggest things, if you really look at it, like the government has focused a lot on creating social protection. And that's a very important perspective here. They've increased their budgetary outlays for it. So creating the right infrastructure across the spectrum is something very, very important. I'm not saying that you have to give dole. What I'm really trying to say here is that you have to create the right infrastructure, which the government has been focusing on. So better schools, better facilities, better toilets, giving the right fuel to the people, and so on and so forth. And that should actually get enhanced because that would actually reduce the pressures on people as well. And this also, there is also one more thing that needs to be looked at is that we need to focus on creating jobs. But the question here is going to be, how do we create resilience within the system that exists? If we have an external shock, how do we create a resilient system from those external shocks is a very key question. But I think this is not the purview of the report, but there is a certain recommendation or a view that we have that we should actually look at. So we need to create what you would call as, say, enhancing security for social and existential level for people. And that is what we need to look at, because this is not the last pandemic and the government has understood it and they've done a great job managing it. It is just now a question of how do we really use this, what we have done during the time of COVID, and enhance it for the future.
Certainly. So how are we going to build this resilience within our system is something that I'll come to you, Professor Singh. But very quickly before that, since Professor Kapoor also mentioned the social protection schemes, Mr. Bhattacharjee, we've seen how over the last few years, social protection cover, especially to the marginalized, has increased, and that has led to some positive outcome within the society. But there are huge gaps that remain in particular sectors. So while in the health sector, there is, there is increased infrastructure that has helped us sail through the pandemic quite well, there are gaps when it comes to affordability. There are gaps within private and public sector, facilities. So how can we bridge that gap if we want to actually have that resilience that Professor Kapoor pointed out? If this is not the last pandemic, so if we are to prepare for future such unprecedented situations, we need to plug those gaps.
Well, at our per capita income, there's no doubt, and that's an average that we're looking at. So that means a large percentage is below. There's not a median, it's the average. There's no doubt that at the lower level, you will have to create the social safety net. The report talks about universal basic income. It talks about it talks about the urban equivalent of the MGNREGA. Now, those are essentially some things that will have to be provided by the state. So we'll have to accept that a certain amount of the state budgets, and I mean center or states, whichever, will now have to be sequestered essentially for that purposes. And this has to be agnostic of the returns, because we are saying that we are really looking at inequality. So that is one of the policy recommendations that come through if this gets implemented. Once that is done, then the next stage will come along is that what is the government's fiscal space that remains to work on for productive asset creation. So, the topic will actually have to be changed. In a way, we have been talking about infrastructure creation, which is absolutely necessary, but now a further dimension gets collected to it. When you're talking about the out-of-pocket expenses on health, on education. So if we are going to say that this is going to be basically provided like an iron bowl, then in that case, I suspect what we'll have to do is we'll have to really re-engineer our fiscal policies accordingly. That this has to be provided up to a certain level with adequate safeguards. There's a word that they've used, airtight slabs, to ensure that there's no leakage in the caste base, which is right. So once those things are created, the next stage is then the government's tax revenues as it comes along. How adequate will it be to create that? So it does definitely create a very interesting challenge in terms of policy making, that how will it be structured?
And is there scope for to accommodate the middle class, which at the moment is missing somewhere from this social security net that we talk about?
I think that will be a bit rich. I mean, right now we'll have to, if we are going to say that we need it at the lower end, then I think the middle class will have to actually accept that there's a bit of sacrifice that will have to be entailed. Of course, it depends on defining who's middle class. The aspirational class, they all look at themselves as middle class, but that's not the point. The number that you're talking about, 25,000 monthly income, that definitely cannot be a middle class in that sense, even though it's there. So essentially, we'll have to then therefore take some hard decisions. Tax set-offs will have to be limited. there'll have to be adjustments made. But then that in that case, it becomes, I mean, their work is done. It's now the job of the government to communicate to the people that, look, if we are going to make those choices, those trade-offs, then why are we making those trade-offs? What does it mean? I mean, an example was the gas cylinder, where people were asked to forego. That sort of a communication, I think, will be now more necessary. Probably what this report does is I think it sort of focuses our attention on the issue of inequality, gives it a non-political sort of an understanding, and makes it easier for the governments to sort of take it on forward. Then what do we now therefore decide to take on?
Okay.
Yeah.
Professor Singh, so coming back to you, so so far so good. We've spoken about the kind of progress we've made in the past few years. There have been efforts which should be hailed by the government because they have helped us sail through difficult times of the pandemic the last 2 years. But as Professor Kapoor also suggested, we will have to create a resilient system which is able to, absorb all kinds of shocks that come in future, and especially those that are unprecedented. How do we go forth, particularly because the challenge before us is a population of this size, this scale? The challenges as it is are abound for us. So how do we prepare ourselves into this more resilient system?
So it's very simple. The government has started its digitalization program. And if we adopt telemedicine and teleeducation, you cut across lots of things. As it is, the report says, and internationally it is understood, education and health, any accident there can take you deeply into poverty. But if you have telemedicine and teleeducation, the problems of having public health centers, that is avoided. So that is one thing. Now, as a government, and if you want the output in the country to increase, which we all want, you have to take care of the labor and you have to take care of the capital. Capital is taken care by the financial sector. Labor is what the government needs to focus on. And I think this telemedicine and teleeducation can come to the rescue, because you raised that issue, is there fiscal space to do all these things? Once you adopt telemedicine, teleeducation, artificial intelligence and machine learning play such an active role that you will find that you will cut across and do much better for the Indian labor, and you will address the issue of inequality. The other issue that I was listening and you were discussing is what happens to the middle class. He's very right. How do you define middle class? If you define the poverty line at $3, which some countries do, if you want to define it at 1.9 severe poverty, that is where the recent study at the IMF has done it. But how do you define middle class? In some places, you can say the middle class is $5 a day to above. Now, if you look at that, now let me mention in the last round of discussion, the issue was, is 25,000 enough? Is 25,000, that's the average salary of most of the population in India, and you enter the 10% top population. If you look at the country's demographics and the labor structure and the labor market, 90% of the country is in the informal sector. And in the informal sector, you have all types of people, the guards, the laborers, the drivers, and you talk to them and look at their salary, it's just around 12,000, ranging between 8,000 to 15,000 a month. So the figure which the report says 25,000 a month is not surprising to me. I think when you look at the informal sector, that captures it. But then the issue is, which you raised in the previous round, was what happens to the middle class? The Food Security Act is providing food to 80 crore people in our country, and they are not below the poverty line. Many of them are in the middle class. To that extent, you are already taking care of the middle class. The free injections, the free vaccines, and during the COVID time, the health facilities that were extended, middle class was accommodated there. Now, I want to just close by giving two more thoughts of mine and sharing them with you. One is, I think, under the Poshan schemes and the Ayush, we need to focus. Poshan should take care of the anemic. The Ayush schemes of the government should be able to take care of the health, affordable health. Now, whenever we talk about, and in this report too, it's mentioned, private hospitals, government hospitals, delivery, cancer, so sort of ailments, and they drain the population out. But the point I'm making is, in this civilization of ours, 5,000 years of our existence, experiment with Ayurvedic medicine, why can't we have many more Ayurvedic clinics across the country, well-trained Ayurvedic doctors who know modern medicine with an additional 6 months or 1 year of training, but who also are of the soil and can provide Ayurvedic medicines at affordable prices. I'm also thinking the insurance companies can go a long way. Right now, they take care of me when I'm sick or in the hospital. But why can't they ensure wellness to me and give me vouchers to go for yoga centers and the gyms when I'm healthy? So I think the whole structure has to be rethought through after COVID and considered if the Indian labor force has to be healthy and withstand another such situation, build resilience. I think we'll have to start from ground zero.
Certainly.
The last point is on employment, which you raised. How is the employment going to come in? That's a major concern. The after agriculture, and agriculture will start weaning and getting modernized as income levels go up. You will be releasing labor force from agriculture. You have a young demographic country. The only way is MSMEs. MSMEs would be the next area where we need to focus on. And I'm starting to now write on, like agriculture universities made us food independent, MSME universities need to be built where we build entrepreneurs and we tell them that self-employment is the way, or the entrepreneurs create jobs for others. Maybe instead of IIMs, now you need MSME universities across the country, building the entrepreneurs and helping the entrepreneurs create jobs in the private sector. I think MSMEs will be the solution to the rising population and rising number of people getting released from agriculture to be absorbed in the labor market.
Certainly. So you've precisely summed up the focus areas which will help us strengthen our systems and help us, take on any kind of challenges head on, as we have done with the COVID pandemic. Thank you to all my guests. Time is running out. I'll have to wind up the discussion at that. It was a pleasure having you all on the program. Share your thoughts and perspectives with us and our viewers. Thank you very much for this very, very insightful discussion. So that's it from us on this edition of Perspective Today. Thank you to all our viewers as well for your time. See you again same time tomorrow now with a new topic and different set of panelists. So until then, take care of yourselves and keep watching Sunset TV.